Hello and welcome back to my channel. Today we're going to talk about a condition that affects millions of people worldwide, Alzheimer's disease. Whether you're concerned about a loved one, curious about your own brain health, or simply looking to understand this disease better, this video will cover everything you need to know. We'll break down the symptoms, how Alzheimer's is diagnosed, and what management options are available. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Let's begin with what Alzheimer's disease actually is. Alzheimer's is a progressive neurological disorder that affects memory, thinking, and behavior. Over time, the disease causes brain cells to degenerate and die, leading to a steady decline in cognitive abilities. It's the most common cause of dementia, accounting for 60 to 80% of dementia cases. Although Alzheimer's primarily affects older adults, it's not a normal part of aging. Alzheimer's disease was first identified over a century ago by Dr. Alois Alzheimer, who noticed distinct changes in the brain tissue of a woman who had died after experiencing severe memory loss and confusion. These changes included abnormal clumps, now known as amyloid plaques, and tangled bundles of fibers called tau tangles. These plaques and tangles interfere with communication between brain cells and contribute to their eventual death. Now, let's talk about the symptoms of Alzheimer's disease. One of the earliest and most well-known signs is memory loss, particularly difficulty remembering recent events or newly learned information. This happens because the disease often starts in the hippocampus, the part of the brain involved in forming new memories. People may begin to forget conversations, misplace objects, or struggle to recall appointments, even though they might remember things from decades ago with surprising clarity. As Alzheimer's progresses, other cognitive functions are affected. Individuals may have trouble with problem solving, planning, or completing familiar tasks such as cooking a meal or managing finances. They might lose track of time, forget where they are, or even get lost in places they know well. Language problems are also common. Finding the right words can become difficult, and conversations may become repetitive or confusing. Changes in mood and personality often accompany the cognitive decline. A person with Alzheimer's may become anxious, suspicious, or depressed. They might withdraw from social activities, avoid hobbies they once enjoyed, or experience sudden mood swings. As the disease advances, agitation, aggression, and even delusions or hallucinations can occur, making caregiving particularly challenging. In the later stages of Alzheimer's, individuals lose the ability to communicate coherently, recognize loved ones, or care for themselves. Basic functions like walking, swallowing, and controlling bowel and bladder movements eventually become impaired. While this progression is heartbreaking, understanding what to expect can help families prepare for the journey ahead. So how is Alzheimer's disease diagnosed? There is no single test for Alzheimer's, but doctors use a combination of medical history, cognitive assessments, brain imaging, and laboratory tests to reach a diagnosis. The process typically begins with a thorough history where the doctor asks about symptoms, their progression, and any family history of dementia. Family members or caregivers often provide crucial information, as people with Alzheimer's may not recognize the extent of their cognitive decline. Cognitive tests such as the Mini Mental Status Examination, Montreal Cognitive Assessment, or SLUMS exam are commonly used to evaluate memory, orientation, language, and problem-solving skills. While these tests can't confirm Alzheimer's, they can indicate whether cognitive impairment is present and provide a baseline for tracking changes over time. Brain imaging plays an important role in ruling out other causes of dementia, such as strokes, tumors, or structural abnormalities. MRI and CT scans can show brain shrinkage, particularly in areas affected by Alzheimer's. More specialized imaging, like PET scans, can detect amyloid plaques or tau tangles, offering a clearer picture of what's happening in the brain. In some cases, doctors may recommend cerebrospinal fluid analysis, where a lumbar puncture is performed to measure levels of amyloid and tau proteins. These biomarkers can help confirm an Alzheimer's diagnosis, though this test is usually reserved for more complex or ambiguous cases. Early diagnosis is important for several reasons. It allows individuals and their families to plan for the future, access support services, and explore treatment options that may help manage symptoms or slow the progression of the disease. Speaking of management, let's talk about what can be done after a diagnosis of Alzheimer's disease. While there is currently no cure, there are treatments that can help improve quality of life. The mainstay of Alzheimer's treatment includes medications that address symptoms. Cholinesterase inhibitors such as donepezil or rivastigmine and galantamine work by boosting levels of acetylcholine, a neurotransmitter involved in memory and learning. These drugs can help delay the worsening of symptoms, particularly in the early to moderate stages of the disease. Another medication, memantine, works differently. It regulates glutamate, a chemical involved in learning and memory that can become overactive in Alzheimer's. Memantine is typically used in moderate to severe stages and can help improve cognition and daily functioning. In recent years, there's been exciting progress in Alzheimer's research, with new treatments targeting the underlying biology of the disease. Drugs like aducanumab and lecanemab aim to reduce amyloid plaques in the brain, potentially slowing the disease's progression rather than just managing symptoms. These symptoms aren't suitable for everyone, and they come with risks such as brain swelling or bleeding, but they represent a significant step forward in the fight against Alzheimer's. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any topics you want covered in future videos. Anyway, beyond medications, non-pharmacological approaches play a critical role in management. Cognitive stimulation therapy, which involves structured activities designed to engage memory and thinking skills, has been shown to provide meaningful benefits for people with mild to moderate Alzheimer's. Regular physical activity, social engagement, and maintaining a healthy diet, particularly the Mediterranean or DASH diets, may also help slow cognitive decline. For caregivers, creating a supportive environment is key. Simple adjustments such as using calendars and reminders, labeling drawers and cabinets, or establishing a consistent daily routine can make life easier for someone with Alzheimer's. It's also important to ensure the home environment is safe. Removing tripping hazards, installing grab bars, and using night lights can help prevent falls and injuries. Emotional support is just as crucial as physical care. People with Alzheimer's often experience frustration, confusion, and fear, and responding with patience, empathy, and reassurance can go a long way. Caregiving can be incredibly rewarding, but it's also exhausting, so caregivers must prioritize their own well-being, whether that means joining a support group, seeking respite care, or simply making time for themselves. One of the most difficult aspects of Alzheimer's is planning for the future. As the disease progresses, legal and financial decisions, such as establishing a power of attorney, creating an advance directive, and discussing long-term care options, become increasingly important. Having these conversations early, while the person with Alzheimer's can still express their wishes, can help reduce stress and uncertainty later on. Finally, research into Alzheimer's disease is ongoing, with scientists working to uncover its causes, develop better treatments, and ultimately find a cure. In the meantime, raising awareness, supporting caregivers, and advocating for people with Alzheimer's are all ways we can make a meaningful difference. Thank you for watching. As always, take care of yourself and make the most of your day.